Okay. There is a confusion about the difference between isolation and quarantine. I found out I was using the terms backwards. I thought quarantine was what you do when you are infected, but it's actually the other way around. So this chart right here is explaining the difference. So isolation is actually the term that is used for people who are sick. And quarantine is the term that is used for people who are not sick, but maybe have been exposed. And when you are in isolation, this separates the people who are infected with diseases like COVID-19 from those who are not. It restricts the movement of sick people to avoid the spread of the illness, and it keeps people out of the public until the risk of transmission to others is low. And quarantine, when you have just been exposed, it restricts your movement, the movement of people, to monitor symptoms for early detection. So that's the point of staying in, so you can see if you're going to develop symptoms. It prevents the spread of infection or contamination, because you have to remember that over 50% of COVID cases are transmitted from asymptomatic people who don't even know they're sick, and should be communicated with clear guidelines from the authorities. So if you have been exposed, you should receive instructions on what to do during your quarantine period. I want us to briefly look at the incubation period and infection period for COVID. It generally the incubation takes 2 to 14 days. And what that means is how long it takes from the day you were exposed to when you start to develop symptoms. It's an average of a 5-day incubation period. Once you have been infected by someone else, you can transmit the virus to others 2 days before you actually show any symptoms yourself. So you're still very infectious even before you know that you have been infected. So again, this is a reason why the isolation and quarantine of this disease is very, very important. Now, how long should you stay in quarantine if you have been exposed? It's recommended that you stay in quarantine for 14 days. That's that incubation period, and you would show any signs of symptoms. You would show symptoms sometime during that time if you're going to have symptoms. Again, you may not have symptoms. There are ways that you could reduce the time of quarantine. So the full 14 days is what was recommended in my contact tracing class. However, there's a way you can get out of quarantine earlier if you do quarantine for 7 days and then you receive a COVID test on day 7. And if that test is negative, then you can get out of quarantine and just monitor your symptoms in case you develop any symptoms. And this is what Tuskegee University recommends for ending quarantine, is that test be taken at day 7. If it's negative, then the quarantine period can be ended. And then if you have tested positive for COVID, how long do you need to stay in isolation? It's recommended that you stay in isolation for 10 days after your symptoms have started. And then you can get out of isolation if your symptoms have improved and you have not had a fever for 24 hours without using any kind of fever reducing medicine. Now, Tuskegee University has an extra precaution for ending isolation. So in addition to a reduction in symptoms, and no evidence of a fever, you must receive 2 negative COVID tests before you can end your isolation. And the reason is because it's really unknown what the number is that separates you from being infectious from you being non-infectious in terms of your viral load. So this extra precaution is going to prevent anyone that is still shedding virus from coming back. Here are just a few do's and don'ts if you find yourself in a situation where you have to isolate or quarantine. You do want to stay home You're going to isolate yourself from others in your home. This is tricky. So if you are COVID positive, you're going to need a situation where you have your own bathroom and you don't have to share a kitchen. So you don't want to have any common areas. So you have to have that type of living situation where you have your own space if you have to be in a house with other people. If you don't have that much room or facilities in your house that you share with other people, you're going to have to find someplace else to go where you're not putting everybody else in your house at risk. You want to call ahead before visiting the doctors, because all the doctor's office have a protocol where if you're COVID positive, you're separated from the patients who are not COVID positive to reduce the spread to the other patients. Of course, you're going to wash your hands often. You wear your face mask around other people and pets, because pets have been known to catch COVID. Of course, cover your cough and sneezes, just your general precautions. This says don't go outside for any reason. I think this pertains to probably a more urban area, but if you're out in the country and there's nobody around, that's not going to harm anybody because there's nobody there to spread it to. Don't let in any non-essential visitors. So you don't want anybody coming in and having to be exposed. You don't have contact with pets and other animals for the same reason that it can be transmitted to animals. And it can go back and forth. And you don't want to share a space with housemates if possible. So that's very critical, because the household spread of this disease is probably the highest rate of spread, because again, you are contagious before you show symptoms, and then you're contagious if you're asymptomatic. And you do not want to share your dishes, utensils, cups, towels, or bedding. You want to have your own set if you're sick. And of course, call the doctor before you go to the doctor, and you don't discontinue your isolation until you're instructed. And then the caregiver, if someone is taking care of someone with COVID, in addition to making sure you're not having this kind of contact, you also want to make sure if you're throwing out the trash for them, that you're not contaminating yourself, like with the dirty tissues and things like that. So that is our brief